Many women hear the words fibroids and polyps during checkups and immediately panic. They sound similar, but they are not the same thing. Understanding the difference can help you manage your health better, especially when dealing with infertility, heavy bleeding, or pelvic pain. What are fibroids? Fibroids are non-cancerous tumors that grow in the muscular wall of the uterus. They're made of muscle and connective tissue and can appear in single or multiple forms. Some are as tiny as a grain of rice. Others can grow so large they distort the uterus. Doctors classify them by location. Intramural fibroids grow within the muscle wall, subserosal grow on the outer surface, and submucosal bulge into the inner cavity. Fibroids equals muscle growths, non-cancerous, feed on estrogen. They thrive on estrogen and progesterone, which is why they often enlarge during reproductive years and shrink after menopause. What are polyps? Polyps are soft overgrowths of tissue found on the inner lining of the uterus, called the endometrium. They look like tiny mushrooms or droplets attached to the wall by a stalk. Unlike fibroids, polyps are made from the lining itself, not muscle. They're usually smaller, but even one small polyp can cause persistent bleeding or make it harder for an embryo to implant. Symptoms compared. Both fibroids and polyps can cause irregular or heavy periods, but the symptoms differ slightly. Fibroids may lead to prolonged bleeding, pelvic pressure, frequent urination, constipation, or even an enlarged abdomen. Polyps more often cause spotting between periods, bleeding after sex, or light infertility issues due to implantation blockage. Diagnosis. Fibroids are usually detected through pelvic ultrasound or MRI scans. Polyps, however, are best diagnosed through a hysteroscopy, where a tiny camera is passed into the womb to view the lining. Sometimes both can be found together. That's why regular gynecological checkups are vital. Treatment options. Treatment depends on size, number, and symptoms. Fibroids may be treated with medications to control hormones, injections like Zoladex to shrink them, or surgical procedures such as myomectomy. Polyps are usually removed through a simple day procedure called polypectomy. The goal in both cases is to restore a healthy womb and improve fertility. Conclusion. The key difference is location. Fibroids grow in the muscle, polyps grow on the lining. Both are treatable, especially when detected early. Always listen to your body and never ignore abnormal bleeding or pelvic pain. Follow for more fertility and women's health awareness. Your body deserves care, not fear.